Hi, teacher. Good afternoon.
Hi Liz, good afternoon. How are you? Is it raining? Is it still raining there?
No, today was sun. It's sunny too.
Oh, that's good.
Yes. And what about you? How are you doing?
Here is windy, and I think maybe at night it will rain. I don't know. We switch the weather.
Yes, I think.
Okay, so I was about to ask you if you have any questions about yesterday or anything you didn't understand,
No, teacher.
or it was okay. Okay, then I want you to explain to a patient what an X-ray is and what a CT scanner does, please.
ECG. And what more?
X-ray,
Okay.
X-ray, and
Okay.
CT
X-ray.
scanner. Did you
Um,
remember?
uh-huh. But in the case of X-ray, it's kind of a machine that will take you kind of pictures, and we could see the bones and maybe air. So, for example, if you suffer any fracture, I will be need an X-ray. Or,
Mhm.
for example, if I think that you could have a lung problem, I will be need a X-ray too. It is cheaper and you don't feel any pain. You just only have to stand up and not moving. That's all. That's what the X-ray do. Maybe you are gonna
Okay.
receive a little bit of radiation, but it's not dangerous because you don't have to be exposed all the time. It's just only one time.
Okay. In the case of an X-ray, right?
This is an X-ray. And CT, the CT is a tomography. This is a more complicated exam. You have to be lying on a type of a strong bed. It's like rigid bed,
Okay.
and it's like a tunnel. So you have to be very, very quiet and don't move, because if you move, the imagine that we have or that we are gonna receive, um, don't is done useful for us. So you're gonna stay like in a tunnel. This machine are gonna take pictures with a more high definition. For example, it take a picture less than 1 millimeter, so we're gonna see any problem that you have maybe. Also, you don't need anesthesia. You won't feel any pain. You just only have to lay on, nothing more. And obviously, the most important, this is expensive exam. You maybe will need $100, more or less, more or less.
Wow. Okay. And let me ask you about this procedure, CT. The sound, it's so, I don't know, noisy.
No, no, no. You're gonna hear some sound, but it's okay. It's not very loud.
Okay. Okay. And what else? Um, the patient has to close his or her eyes.
Um, it's not necessary, really. In X-ray and TC is not necessary that you close your eyes. But if you wanna feel more comfortable, maybe you can do it.
Okay.
Mhm.
Okay. Thank you very much. Then I have another situation. Uh, Maybe you can explain to a patient why you are referring her for an ultrasound scan or an MRI scan, and what she can expect to happen during the procedure.
Okay. We're gonna suppose that you have some problem in your abdomen. So, for example, a trauma. So, if you are my patient, I will say that when you have a trauma, several organs inside you could be affected. So, we need to see what is happening. We need to see if you are bleeding inside or you have any abnormal liquid inside. So, we need an exam that is called ultrasound. You don't have to worry because this exam, first of all, is very cheaper, and the second, um, we are gonna use only a kind of transductor. That is a little device that we are gonna put in your abdomen with a little bit with gel or jelly, and it don't cause any pain, any any kind of molestias in English.
Wait. Okay, but I think it has a very particular synonym. But by now, annoyance.
Annoyance. Okay, thank you, teacher. So you're gonna feel any annoyance. Also, we are gonna see your problem in life. It's not the same when you take a X-ray or because we are gonna move it inside you more or less, but we are gonna see the problem in life in this moment, and we are gonna know that what have to we do or what do we have to do. That's it, right?
Okay. The word, maybe the synonym of annoyance, it will be irritation, exasperation.
Irritation.
Okay.
Mhm.
Okay. And I was wondering, uh, I yesterday we saw an image where the ultrasound was on the knee, right? So I don't know what a doctor can see there. The
Ultrasound of the knee.
Yeah.
Well, we see the
What do
articulation.
you have to see?
We'll
Okay, the
see
synovial.
the liquid, synovial liquid. And between one bone, another bone, we have like a kind of space with liquid. And that space have like una capa,
A capsule.
a capsule. That's the right word.
Okay.
So when you have a problem, a fracture, a punch, maybe when you fall out, we have to see that the capsule it's okay. Maybe sometimes the capsule broken, and you have a problem. You have any edema. That's why we
Mhm.
need a ultrasound.
Wow. Yeah, that's good. I was thinking what to see in that area. Okay. Another question for you, maybe, or another situation, it would be describe an ECG tracing of one of your patients to a colleague.
ECG, okay, in a patient alcoholic. Uh, well, the alcoholic is the first cause to produce heart attack. If the patient is very fat, is another problem. So probably in the ECG, we are gonna see an elevation of the in the ST complex or the ST line.
Okay.
So if we see an elevation of this line of this part of segment, maybe it is telling us that you are suffering a heart attack. Uh, in Spanish is infarto agudo de miocardio.
Yeah.
So we'll
Okay.
see heart, acute heart, myocardial acute heart.
Yeah, yeah, that's it.
Yes, that's
Okay.
what it is.
Um, okay, that's very interesting. It wasn't the question, but it was really interesting. I was telling you to describe an ECG tracing of one of your patients to a colleague. Tracing off, it's like rastreo, but maybe talks about refer to a colleague.
That I have to explain patient what he or she are gonna expect of the exam. What is the procedure?
You have
That's the
to
question.
describe an ECG, and what was okay, what did you find out in that tests?
Like refer to another doctor.
Yeah,
Uh,
that's
sorry, sorry.
that one. I was sick.
Okay.
It's okay.
Maybe dear doctor, whatever, Doctor Shepherd, maybe. I have an alcoholic. Sorry, teacher, the internet is. What did you say?
No. I was just laughing.
Uh, by Doctor
That
Shepherd.
continue. I'm sorry. Yeah,
Yes, like our crush.
yeah. Everybody's crashed. That's good.
Okay, so I have an alcoholic patient. He is 66 years old, and he comes to my consult with
Hmm?
pain chest, maybe. So I did an ECG, and I found elevation of is ST complex. So I'm thinking that maybe he has a heart attack. So I need that you review or you check the patient the most currently possible. Mm, and I think like you and specialists, you could be more help for the patient, or you can
Okay,
help more. I don't know.
okay. You can be helpful for the patient.
Helpful, help. That's
Okay, okay. That was very good. But I don't know if you want to add something else.
mm, maybe I
Something about
took the
the
blood
exam.
pressure. Ah, the exam.
Okay. Oh
I
no,
took the.
whatever
It's okay. Yeah.
you
So
want.
I took a blood pressure, and I found two no 180 over 90. So it's a little bit higher. The
Yeah.
cardiac rate or pulse is a little bit higher too. So another important thing that the patient is very fat, or he has obesity,
Mm-hmm.
and he smokes cigarettes almost one uh, 5 cigarettes per day. So I think the patient has higher risk higher to suffer an heart attack, a complete heart attack. Yeah. Hmm.
Okay. Okay, that was really good. Thank you, Liz. Thank you very much. I will send to you. I think it's uh it was very fast, right?
Yes,
Or I'm just thinking.
yes, because
Okay.
I finished the talk and then you said thank you, and I was like, what? We finished?
Yeah. Okay, please. Thank you. But we can still talking about maybe exams, laboratory exams. I don't know if you use it so much and you like to tell the results to the patient. I'm sorry. I will take it up.
Yes, I use laboratory exams. I'm gonna describe the my mom case. She had a surgery 3 months ago, more or less, and she has to do the basic exams. You know, hemogram. Is Salome here? Okay.
Oh yeah.
We continue
Okay.
teacher another day.
Okay. See you. Thank you, Liz.
Hi, Liz.
Goodbye.
Bye,
Have a,
Thank
Liz.
you. Bye,
have a
teacher.
good
Bye,
night.
Salome.
Bye. Thank you, Liz.
Bye.
Take
Hi,
care.
teacher.
Hi, Salome. Good afternoon.
Good afternoon, teacher. How are you?
Fine. Thank you. Liz told me that there is hot now. It's sunny.
Yes, finally, after a million days, is fine. So it's
Yeah,
okay. The weather is not sunny, but not raining. It's in the middle.
that's
Yeah.
good. Well, here it's a little bit cloudy,
Mm,
and maybe I don't know, but tonight I think it will rain.
yeah.
Just a little, but it will rain. Well, we switch off.
Yeah. We changed it.
Yeah. Okay. I will put you in some situations, okay?
Okay.
Can you explain? Well, I know you're a nurse, and maybe the doctor's job to tell a patient these kind of things. But in your experience, I want to know what would you say if you were a doctor, or if you see or saw that situation, what does he says? Okay,
Okay.
explain to a patient what an X-ray is and what a CT scanner does. Do you remember what is a CT scanner?
Computer tomography.
Okay.
Okay. If I have a
Yeah.
patient to actually that is the job of the a nurse. Explain the patient what is the procedure that in the laboratory will make. Uh-huh. So if I
Okay.
have to explain a patient, I started that a radiography is a procedure where we expose in a radiation uh, with the objective to know what is the condition of or part of the body, because we need to know what is the form, the spessor, if it's thin or is grows, all the kind of the structure of the organs and what is happening there. We which simple exams of laboratory exams we can see it. So I explained that it's not dangerous to be exposing for radiation because it's only a short time, so it's only like a click, and that is the computer can take that. And for other way, the computer tomography, uh, I explain, in especially if our pediatric patient that don't have to be scared, is only a big machine that we put we put the body in the machine
Mhm.
with finally to take a segment of the part of the body, uh, maybe to watch what is abnormally there in specific of the part of the body. Maybe if it's in the leg, only the leg, but it's in the stomach or the chest, we need to put in all the body, and it's no painful. It's only like a minute. Maybe you will listen a very hard a noisy. It will be noisy, and maybe so in some laboratory, especially in private laboratory, make a headphones, a big headphones, for don't listen that. How do you say ruido?
Sound.
Sound, that sound. Uh-huh. And that's it.
Okay. But uh, about the lesson we saw yesterday, we know that people cannot use metal earrings or something with metal, right? Just on CT or
Sure.
on X-ray too?
X-ray too is better because if we use earrings in the ears, we make a contrast with the part of the body. Or when the person have piercings in the toe or in the belly, is to have to retire that. In the
Oh,
computer tomography, I have to ask in adult patient about the laboratory exams for know about the creatinine, because if this is a high, we can make the computer tomography if we use a contrast. That is a liquid that the patient have to drink for make more specific the tomography in the exam.
okay. And is it painful?
No, X-rays and computer tomography are no pain.
Okay. And the last question about this. The patient has to use some kind of protection on his or her eyes, or no, or it's not
Uh,
necessary?
is not in the computer tomography is not necessary, but in both exams have to be only with a chirurgic clothes that make in the laboratory in both of
Okay.
them. But I don't know if X-ray have to use a glass. I don't know there. I think no. But in computer tomography, no. Only the big headphone because I be patient when I have to make a computer tomography.
Okay. Thank you very much. I have another situation. Okay. Can you explain to a patient why you are referring her for an ultrasound scan? Can you?
Sure. Yeah. Sometimes in the hospital, I explain her. Sometimes in the hospital we don't have all resources for do all that kind of things. So the ultrasound
Mhm.
is a kind of exam where use a high frequencies for try to know what is happening in the body. So it's like an scan all the body and all segments. And this exam is not common. It's not because you are really really sick. It's because your kind of diagnostic is different of the normal. You need to know more for be sure that what is the diagnostic. So you have to be relaxed and have to be really quiet in the exam and don't move. For the ultrasonic can be all of the cavidades of the body, special
Cavities.
cavities in the when we are pregnant because we can move because the baby is moving too.
Okay. Okay. And can you explain to a patient why you are referring for an MRI scan and what are the differences?
Okay, this exam is most in traumatologic disease because here in the cavities we have a liquid sometimes, for example, in our neck. We have cavities that have liquid, and the magnetic resonances we can watch if this cavity is okay or is broken or is with a fixed. We have to be a fixed of kind of things, but it's not dangerous, it's not painful. We have to be really exactly with the movement we can see. And I have to ask if the patient are pregnant, because if is pregnant we can make a magnetic resonance.
Okay. What will be the consequences of making a resonance, a magnetic resonance?
I think because the resonance we can affect to the baby, the space of where the baby are growing up. I think we can maybe make a disturb there.
Okay. Okay. Thank you very much. And about those two last situations, uh, what the patient can expect to happen during this procedure? I don't know. They
The
will
risk
feel
that
something. I'm sorry?
you mean that the risk that patients have in these exams?
Yeah, maybe the risk, maybe they will feel something, or it will sound
Okay.
noisy, loud.
In all the exams, how is in how do you say camilla in the bed? In the bed transportation?
Yeah,
Okay, in
the
the bed,
hospital.
yeah, the hospital bed. All these exams we use a hospital bed. Maybe the patient can fall, for maybe is scared, or maybe is if is a child is like really chumpy, like inquieto or something like
Mhm.
that. Okay, in the X-ray, I think it's no is a risk, has a risk this exam. Yeah. In the computer tomography, maybe the patient who use a contrast during a contrast a liquid contrast, maybe in the next hours have to eliminate all this
Eliminate.
contrast for the urine. So this patient, if don't drink a lot of water, they could make a daño renal.
Feel nauseous?
Yeah,
Oh,
issues, issue.
oh,
They maybe can do this, so they have to drink a lot of water if used contrasted liquid. And the last ultrasound, no, it's no, no, it's not. Don't have risk this exam.
no, it's not a problem.
Mhm.
Okay. Uh, uh, the correct word for Camilla is
Mhm.
stretcher.
Stretcher. I
STRE.
okay, and for
Yes,
the
it was a
renal is
photograph.
injury, injury,
Renal injury.
a renal injury. That is okay.
Yeah.
Yes.
Okay. In the last situation, Salome, uh, can you describe an ECG tracing of one of your patients to a colleague?
I don't understand what it means.
A, an ECG tracing of it's maybe the procedure or the results you find out on these tests, and
Uh,
you have to explain to a colleague about your patient.
what is Cody?
Colleague is another doctor
Okay.
or
Sí.
another nurse, in your case, your colleague.
Okay. Like a colega.
Yeah, that's right.
Okay. The most common that I c- that is really difficult, because read all that kind of exam is really difficult, because sometimes I am trying for it's like a mancha, like something like that, and the doctor said here is a stomach, and I see only like a circle, and that's it. So I have to be really have a lot of training to read that. But most common that actually I can read is a X-ray of the lungs. Uh-huh. So sometimes there,
Okay.
okay, if I have to bring my patient for my colleague, I try and I have a X-ray. I can show her where is the look, what is if the looks have secretion, if it's like clean, and this part are clean or there is with secretion. Maybe if have a nasogastric sound,
Uh-huh.
we can see in the tomography and the X-ray, sorry, and I see, okay, this thing is as a nasogastric zone, so you have to see the lung is here and prove that is correct. And
Mhm.
we are given we are administrating this antibiotics antibiotics the patient for all this part or all kind of things. And we have when we have an X-ray, we can see, oh, for example, the right loop have too much secretion, so we have to put for the other side for the patient, because if you push too much with your weight, the loop, you can eliminate all the secretion, so you have to put the opposite side in this case. So for that we use sometimes for know which side we have to put in the patient.
Okay, thank you very much. It explains so well
Right.
what you do. Your colleague telling you the patient case. Okay, I will send to you my questionnaire, please.
Okay.
Oh,
Okay.
okay. Oh, you're the only one who. Thank you.
Okay, teachers.
You're the only one who is so happy to be here.
Yes.
With
Yes,
us.
I like it because the course is we can it's not like a class only. Okay, we this day we talking about this topic. Blah, 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 blah. Is we can interact between all
Yeah.
the classmates and you like teacher, and we explain if I don't know something or my classmate don't know. It's not like we try to explain us in different ways.
Yeah,
And
we can
the most
find out together, right?
Yes, and I like too much about this class because one day my mother was here with me, and she doesn't
Mhm.
understand English, but she was told me in the final of the class that all the in Carla Liz we participate the three, not only one or not only Liz, and sometimes say, and if you don't know something about the medic things. I said my mom, okay, Liz and Carlita explain the teacher, and after I say my opinion, but if I don't know, they explain me too because I am a nurse, and sometimes I don't know, and that
Yeah.
is like a good methodology to learn. So I am really proud of it here.
Oh, thank you. I really appreciate your opinion. It's so good to me. Okay. I don't know if you can add something in these few minutes. I don't know if Carlita it's gonna make it, but we can still talking about any topic you want. Maybe a laboratory tests or another thing you can usually work on your job.
Okay, like we said yesterday about the electrocardiogram. Oh my god,
Mm-hmm.
that is really, how she say, is really difficult because if you don't know something, it's like a murder. The patient see you like a murder because in emergency sometimes the patient be with the familiars, not only the patient. I saw so and I that was my experience when I was in emergency. The internship, the internal medicina make the electrocardiogram because it's easy to put all the lagartos and make the impression, prime the things. But when you have this in your hand, if you don't know, it's like, oh my god. And the internship was watching, trying to describe the electrocardiogram until the medic the yes, the medic treatment arrived. So the familiar was watching that, and she started to talk. They are murder because they don't know what to do with my father. Yes, was my father or my grandfather, but I don't remember. And I was talking that with my mother yesterday, and that is like I don't know who have the fault, if the internship or the medical resident for don't arrive on time. And that really, it really, oh my god. For that, I decide to these days to put me study about the electrocardiogram only in case I have to be in emergency area.
Yeah, and did you start to do that? Because I think because of the talk we had yesterday, I think it's very difficult.
Yeah,
It wasn't like something static, you know. It's like,
yeah,
what are you going to
some
say?
fear. Yes.
but it's so good.
Yeah, that was talking with my mom yesterday. That was okay. And with the book is like really helpful for us. Really helpful. I don't know what happened with Pauli. I was talking with her, but she said
Yeah.
I be absent like for class, and I was like shy to join again. But I say, okay, you lose your money because you are not going. Maybe you can put in on time with, maybe the teacher can see you, can tell you go to see in YouTube. But she was really like, no, like don't be sure. So okay, it's your
Oh,
decision. Yes, but she told me, okay. I said, okay.
oh, I'm sorry for her because I think you practice a lot here, and it will serve to her. But maybe she's, like you say, a little bit shy.
Yes, maybe. And the first class, it's that really that is true because in the first class, the teacher that we had was a good teacher, but sometimes he speak very fast, really fast. And if you know, in our level is like this, to high to less: Liz, Carla, me, and Pauli. Before you, with the other teacher, Carlita wasn't here in the class, so was Liz, me, and Pauli. And she really, because the teacher speak really fast, and sometimes only Liz speak, and you're like, oh my God, what is saying? And sometimes I feel like that. I imagine if Pauli can, if I can understand, like I so try to have a heart, a good
Mhm.
heart. Probably maybe feel like, okay, I don't know what it's saying. And she, sometimes the teacher asks something to her, and probably doesn't know to answer or don't turn off the microphone, and I write for WhatsApp, by WhatsApp, what is asking her, and she answered. There's
Oh,
that.
that might be a little bit uncomfortable for her, and I understand that. I
Yeah.
think if you're practicing English, and as everyone, we have a little bit an accent, a Latin accent, right? And it's better to speak a little bit slowly. I don't know if
Yeah.
you see some advance on your, or on your talking, on your speaking, and an education for the ears. What
Yes,
about
I
that?
really see, because sometimes I like join the class and start to talking or making the class, and okay. And when we have the speaking, some days are like, okay, I go really fast. I be excited about talking some topic, and have days that are okay, it's normal, but it's okay. And I think that I learn a lot of vocabulary, and that is good because it's not like to study in your house. We don't know how to pronounce some word, Carlita, Liz, or myself. I asked you, and so you answered in that moment. I write something like that, and we don't have like too much space for unloading. So that is good. I really like this, and maybe with this academic, I'm thinking about the course first, trying to prepare for the TOEFL or the FC.
Yeah,
I was talking
that's good.
about that because that is good, a good methodology that we have.
Okay, Carlita. I'm so sorry, Salome. I'm thinking about Carla because she's not gonna make it, I think. But it was nice talking to you as always, and I appreciate your opinion.
Thank you,
See you
teacher, for being a good
tomorrow.
teacher.
Thank you. You're a good student. Thank you very much. See you
Okay,
tomorrow then.
see you tomorrow, teacher. Bye. Good
Take
night.
care. Bye.